Calf pain causes and treatment. The calf is the area at the back of the leg that is situated between the back of the knee and the ankle. While calf injuries may seem relatively insignificant to knee or ankle injuries, calf injuries can be a significant source of lower extremity pain and immobility. Calf injuries are commonplace in sports, especially contact sports and those requiring pushing off from the toes. Direct trauma to the calf may occur when the calf is compressed or struck during a fall or car accident. However, if the calf muscles are tight, fatigued, overexerted, or overused, even the most routine daily activities can result in a calf injury. Muscular imbalances that involve the quadriceps being stronger than the calf muscles can also place one at risk for a calf injury. A calf strain is an injury to one or more of the muscles and/or tendons in the calf. Strains occur when the fibers of the muscle and/or tendon are forcibly stretched beyond their normal elasticity or torn. A muscle contusion is a bruise that reaches the muscular level. It is the result of an impact, trauma, or compression that crushes the calf muscles against the underlying bone. A calf cramp is a sudden, forceful, and involuntary contraction of the calf muscles. Calf cramps often accompany traumatic injuries to the muscles and bones of the lower leg. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the Sinew herbal ice on your calf to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the calf. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your calf with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your calf with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Soak your calf with the Sinew Relaxing Soak to relax muscles and tendons that are in spasm, ease joint pain and stiffness, and improve range of motion. The Sinew Relaxing Soak is particularly useful if you feel restricted mobility in your calf. The soak can be used by saturating a towel in the liquid and applying it to your calf. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.